With the hospital authority, and if you could introduce yourself and your colleague and then make whatever preliminary statements you'd like to make, I'd appreciate it.
Sure. Jason Boyd, CEO of the Hospital Authority, and I have Bob Lonis here with me, and Bob's CFO of the Hospital Authority. First and foremost, just on behalf of our board and our employees, appreciate the time to come here today and talk about the things we've done, and appreciate the support that your team and Rich has given us throughout the year. You know, as always, it's been a challenging year, and I think with the changing landscape in the healthcare industry, rightfully so, we've gone through some very tough but necessary changes. You know, and these are changes that I think every hospital in the city is going through, whether you're for-profit, not-for-profit. But these are things that we feel we have to do to be viable, to be sustainable going forward, and making sure that we're being efficient, making good use of taxpayer dollars. One thing that, you know, we can all be very proud of is the Hospital Authority is really meeting the mission. Just at General Hospital this year, we're projected to do about $93 million in uncompensated care. Unfortunately, we've continued to see that rise. That's up about 13.5%. From last year, and that's just at the hospital. So that's a critical point of care in the community, and we're proud to meet that mission. Just from a
Can you give me those numbers
yes,
again? How many people received uncompensated care?
I don't have the people count. I can get you that. It's about $93 million in uncompensated care, and that's up actually 13.4% over prior year.
Is that the highest it's ever been?
It is. As percentage of revenues, that's about 41% of our total revenue base.
Okay, sorry.
But that is, that's the highest it's ever been. We feel we've made some great strides this year across the authority. Going into next year, we're projecting our direct expenses to be down about $13.5 million over prior year. We feel that's a significant number, and that's really a product of one, sticking to some very stringent productivity benchmarks, making sure we're performing at a high level as, you know, in regards to our peers. A lot of re-engineering of our operations, contract negotiation, just managing our supply chain, just being good stewards of our business. The Metro Incentive Plan still continues to be a good program for us, and again, we appreciate the help in getting that set up a couple years ago. As it looks this year, we will net about $1.7 million in revenue off of that program. That's net.
That's good.
And we got NES join the program in December of 2012, so we hope to continue to see that grow and be an access point and a benefit for Metro employees across the city. Another program that we have implemented that's been tremendously successful, even more so than we thought, was our transition to our work-related injury program. We are expecting to see over a 50% savings in that program this year. You know, specifically, just an example of that, at our long-term care facility, Bordeaux, they're running at 20% of the rate that they were running a year ago under the old program. So that'll probably approach between $800,000 and $1 million savings year over year.
Jason, take a second and help us understand exactly what that program's intended to do, what the objectives there were, and sort of, it's a good success story, I think.
Mm-hmm. Right, so, you know, the objective of the program, one, is to, you know, first and foremost, make sure our employees have an avenue, an appropriate way to get taken care of and ultimately return to work if they get injured on the job. So we looked at this and looking what other organizations similar to us do from a work-related injury standpoint, and kind of modeled after that. Very thorough case management process when that employee gets injured, helping the employee manage where they get their care, more of a restricted type panel, I guess, for a lack of better words. Really just at all angles of the program, from the payment mechanism to how we manage and work with the employee to get them back to work, to pre-existing conditions that might have came with the employee prior to their employment at our organization, And we've just seen tremendous success with it, and I think the employees have been pleased with it. We're getting folks back to work quicker, safer, healthier. Across the authority, again, we continue to try to make sure that we're keeping up from a technology standpoint. We've done some good things this year, upgrading our radiology system. When you see that PACS, that's Picture Archive Communication System, just really the ability of our radiologists to see images anywhere they're at, whether they're at home, whether they're at the hospital or in their private office. We've done some upgrades to our mammography equipment, our CT equipment, some voice recognition software that allows a physician to dictate into the machine, and it produces the report for them, which generates not only time savings but financial savings. And through all this, ultimately our ultimate goal is quality, high quality health care. And we've been fortunate across all of our 3 organizations in the authority to have successful surveys over this past year, and are very proud of the work that our staff has done in doing that. Also, one thing that we're very proud of, one of our community-based programs, is our Mammos in May program. This has been going on about 10 years, and over that time we have diagnosed about 22 women with breast cancer that otherwise might not have had the opportunity to get that exam and find out that they had this illness. So those are the type of programs we hope to expand on in the future. I think it's what our communities need, and we're very pleased with the results of that. Our long-term care campuses have done great things as well. We've gone through a lot of changes there. We have a partnership with Lindy RSS, which has a chronic vent unit. We've gone through some expansion of that, and here this month we'll be expanding that to 38 beds. Right. Been a very successful program, actually named for Lindy one of their top vent unit programs in the United States, so we're very proud of that. Going forward, again, we really have to look to the future and continue to retool, redesign our operations while keeping our quality superior. Capital equipment wise, I think this is going to be a pretty significant issue for us going forward. Not just major medical equipment, but from just a basic infrastructure standpoint, primarily around IT, as regulations change with ICD-10 billing requirements and meaningful use and all those things that we have to meet. So that's going to be a big thing for us to focus on in the future, and really continuing from an access standpoint, focusing on the clinical services that we provide to meet our community needs, because we've seen that shift over the years, what our community is wanting from us. A lot of that is shifting toward our outpatient services. Our clinics at the hospital will do about 40,000 visits this year. The emergency room's up to about 36,000 visits. So we're really seeing on the demand side that's where it's at, and that's where it's going to be critical to work with our partners at Meharry Medical College from a physician recruitment standpoint going forward, to make sure we can address those needs, because the community needs change, and we need to make sure that we recognize that change to the community. Strategically, there's, as you know, there's a lot of big things out there in the healthcare world. Always concerned from a state and federal funding standpoint with disproportionate share dollars. The Medicaid expansion question is out there. We're hopeful. I don't see it that the governor said no to Medicaid expansion. I think he's just looking at another avenue to try to make that happen. Obviously, for us, that's critical with the amount of uncompensated care that we do have. Because ultimately, with some sort of expansion, we have disproportionate share dollars that go away as well. So, I mean, that's a critical thing for our hospital going forward, and in order for us to really create a sustainable model. Also, with the employee buyout that we had, it's one thing that I would say kind of caught us by surprise a little bit. We really underestimated what the impact of that would be. At the end of the day, we had about 125 employees that took advantage of that program, and that's great for them. But operationally and financially, short term, it really has been a challenge. That's about 14% of our workforce. So it's not just institutional knowledge, but the immediate financial impact. But long term, when you look the run rate into next year, obviously you do recognize that savings back fairly quickly. But just working through operationally how to bridge that between now and then has been critical for us. But our folks, our employees, everybody from the dietary worker to the housekeeper to our executive team and our board, they've really been outside of the box this past year, and I credit our success to them and the things that we do and our medical staff. They're the ones that really make it happen, and they've really been able to band with us and help us change what our model looks like to make sure that we can be successful going forward.
Do you have any thoughts on what's going to happen next year with state funds, or?
It's somewhat a moving target, and we saw, and I can let Bob chime in on this some, we've seen some impact this year. We had an unexpected hit probably of about $900,000 this year.
Right.
As some of those formulas are based upon TennCare volumes, et cetera, and as that shifts some, it's kind of a moving target. We feel very confident that we're able to secure our public hospital supplemental funding for next year, so that's critical to us. Other than that,
basically we still get $2.5 million from the state for special funding. We did take the $900,000 hit this year. I think everything's a moving target. Obviously, everyone's facing different budgetary issues and whatnot, so we really don't have any certainty as to that. We do know that on the Medicare side, of course, the dish that we get, fortunately for us, it's a smaller number, about $800,000 a year, is going to be phased out along with the Affordable Care Act. So it's important, obviously, that we get some type of program to help replace some of the uncompensated care, whether it's through the exchanges or whether it's through the Medicaid expansion, et cetera. That's how we're going to be able to break even on the revenue side.
And if, from a sequestration standpoint, if that ultimately pans out, it's about a $350,000 a year impact on us if that does go through. We have relatively low Medicare volume.
Yeah, we're kind of unique in that regard. Medicaid is 4 times our Medicare activity, book of business, so that's not typical with hospitals, but in our case it is.
Okay. Rich?
Talk about this for a second. The supplemental funding that we've been receiving over the last 3 or 4 years, that's been pretty critical because it's been, $12, $13, $14 million. And my understanding from discussions with you before is that you think that's good again for at least next year and maybe a couple years thereafter. Is there?
We do. We feel that it'll be secure for at least the next year or two. We're doing the work now with the state and doing the formulas off our cost reports, et cetera, to get that. We expect that to net 12.3.
12.3, 12.5 range, yeah.
So obviously that's a critical component in on our revenue side going forward. But we feel very confident that at least for this year and potentially the next year that should be there.
And when do we know for certainty that's there? Is it later in the fiscal year, or is it?
Yeah, typically, Rich, I'd say early May, we have a definitive response from the state, usually on that. We've already begun the process of providing the numbers, the calculations, et cetera, so it'll be imminent within 30 days, I would think.
Do you have a sense of the $93 million of uncompensated care, what percentage of that is inpatient and outpatient?
I really don't. I know our ER and our clinics are heavily weighted toward that, and of course that's where our growth is. Right. I know the charity component of it is about 75%, that total uncompensated, and then the rest is your private pay / uninsured. I would probably say 60-40 outpatient. It's probably the heavier.
How much of that would get picked up if expansion happened or exchanges? Do you have any idea?
You know, we looked at it.
Have you guessed? Can you guess?
We've estimated a couple different ways. You know, a lot of hospitals, even here in town, are looking at, say, maybe somewhere between 30 and 40% might convert. And for us, if 30 or 40%
Right.
converted, it's $7 to $8
million.
$7 to $8 million
thereabouts.
a year.
The key's going to be, again, I think anytime you get a program where someone has a ticket, if you will, that can go to any hospital. The question is retention.
Yeah, right.
You know,
Right.
conversion's one thing, but then you got to be able to retain them in your institution.
Right.
Anything more, Greg?
I don't think so. We've got to follow that pretty closely as we go forward and
Absolutely.
as it impacts the hospital, but nothing else.
Okay. Well, thank you, and thank you for what you're doing, and appreciate your willingness to try other things. It's commendable, and thanks for the presentation.
Thank you so
Thanks,
much.
guys.
Appreciate it.